found out that I had a lump, we went to go see a surgeon, and he figured out that it was a tumor.
So it was a big tumor. It was benign, but it was one of the most aggressive in its kind, and it can grow like really fast. So we needed to act like really quick.
Veronica was sent to me by an outside surgeon on referral. She had a myxoma of the lower jaw, which is a very aggressive, benign tumor. We were able to talk to her mother and father, and also discuss with them what the plan would be, our experience with this, and what the goal of the surgery would be.
So we came in and talked, and we found out that they specialize in this, or they had like a very good way and a good plan to be able to get rid of the tumor.
We actually have a session where we go through and we actually do the surgery all virtually prior to even entering the operating room. We were able to also use virtual surgical planning for reconstruction of the nerve that supplies sensation to the lower lip and chin, which is usually sacrificed during these cases.
I was kind of worried because they were kind of like, oh, you're going to lose your teeth, and we're going to take like the whole part of the jaw out, and then we're going to use a bone from the leg and then fix it, which I thought sounded really scary.
What helps us here in our department is that we're not only physicians but dentists as well, so that lends itself to really dealing with patients when sometimes they're most anxious. And in Veronica's case, she was anxious before this time, obviously for school and her grades, and worried about her participation in sports, which is very important to her.
I do Taekwondo, which is like a form of martial art that usually uses the lower body. I was really worried for the board breaking because I wasn't sure how much it was going to hurt and if I was going to be able to do it.
It's a university hospital, so they probably have the best technique, and the technologies and everything is there. So if you go to another place, you won't have what you get at UAC.
We have a variety of specialists who can help us in the treatment of these patients, and we are doing things here using state-of-the-art technology and imaging, pre-surgical imaging, and surgically assisted imaging that only very few centers in the country, and in fact the world, are using to help patients with oral facial conditions.
We have access to pediatric dentistry, prosthodontics. In the cases of cancers, we have access to radiation oncology, medical oncology, all the specialties needed in a multidisciplinary tumor board and cancer center.
During the surgery, it was great. So we were notified all the time, like every so often, about the progress of the surgery.
We're glad that we chose UIC because of the people and the care, mainly. The people also really make sure that you're feeling good and they're there for you and for anything you might need.